Medical Dilemma.
Welcome back to Medical Dilemma. Before we start our discussion for the second segment, we'd like to say thank you to our major sponsors, St. Clair's Medical Center and LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment of this show are my co-hosts, first of all, Attorney Sara Jane Suguitan, and Father Jerry Manlangit, and sitting in for Dr. Attorney Teresita Sanchez is Dr. Attorney Ivy Patdu, who's also a professor at the Law School of Ateneo. Okay, welcome to the show, everybody.
Hi, Sonny.
Yes. Okay, now, before the break, we were showing some slides taking a look at the 10 most common diseases of the skin. Now, maybe we should continue on with the remainder of the slideshow.
Okay. So shall we continue with the slides? So these are warts, no? They are viral in nature and very infectious. And you can get them from wearing contaminated slippers, contaminated things, that handling dirty things, no? Yes, next slide, please. This one naman are warts in children. So we see them commonly in the pediatric age group. It's called molluscum contagiosum. And they also proliferate very fast. So mabilis silang kumalat. And one way of treating them is you have to remove yung particles inside those papules kasi yun yung infectious part eh. Yun ang nanganganak.
These are viral.
These are viral also. Next. So yan. So we prick them and we remove the sago-like structure inside. Next. Ito naman, fungal infections, no? Men often have them kasi you're always wearing pants. Tapos, namamawis kayo dyan. So, minsan yun. And sometimes, wearing of clothes that have not been adequately rinsed. So, may konti pang traces ng detergents. Tapos, suot, yun, nagkakaroon din ng ganyan, proliferation. So, yan ang fungal infections. Makate, kumakalat din. Next. Ito, this is, I think, my last group of diseases. It's called dyshydrotic eczema. Unknown ang cause, but it is very chronic. Paulit-ulit, and you see them as like vesicles dun sa sides ng fingers. But they can become infected, so ganyan, nagkakaroon ng open wounds. So, yan, sa paa. No? Very chronic in nature.
And the cause is unknown.
And cause is unknown, but we think it's probably stress-related then.
Stress-related.
Yes, because sometimes, all of a sudden, you will just break out into this eczema-like lesions on the hands. And it keeps on recurring.
I see. Okay.
So this is just something to show that patients should be careful when they're having their skin diseases treated and just go to
any dermatologist clinics, supposedly.
Hopefully, they will go to members of our society, the Philippine Dermatological Society.
I see. Okay, well, that's fair warning for our viewers. Yes. Okay, so Doctora, from those slides, I surmise that the causes of skin diseases are all external.
Yes, not all are external.
So there are also some internal origins.
So one particular example is atopic dermatitis, in which there is a genetic factor. So in atopic dermatitis or patients with these kinds of diseases, some members might have asthma, some might have allergic rhinitis, and some would have the eczema. So there is a genetic trait that runs through certain families and causes them to have this. They inherit it, no? Families, throughout their families. Some skin diseases naman, unknown ang cause, like for example, like yung mga psoriasis, they said there's also genetic factor, and now they're saying that inflammatory components have a role to play in the perpetuation of psoriasis. Most kinds of skin diseases that are chronic in nature, we would say would have an inherent factor in it and not easily treatable because yun nga, because of certain causes that cause them to become chronic.
Okay, so being chronic is a characteristic of such diseases.
Yes.
The ones that have internal causes.
Meron din naman infectious in nature, madaling matreat.
Infectious.
Like leprosy. Leprosy
Okay.
is treatable. It's treatable now. So there should not be a stigma now for patients with leprosy.
And that's categorized as a skin disease.
Yes, it is caused by a bacteria kasi.
So it's a bacteria
But it is
caused
treatable.
disease. I see. Now, earlier we were talking about my wife's condition. She suffers from rosacea.
Yes.
Now, what exactly is the nature of rosacea?
Rosacea is characterized by redness of the central part of the face. So what is affected? The nose.
Yes, the
So
cheeks.
itong central part of the face is affected. And sometimes you can get pustules, may mga nana-nana dyan. But the basic feature is redness. And it's hard to control that redness. They say that some of the causes are taking spicy foods or drinking alcohol
Yes.
or stress also has something to do with it. And sunshine or so much sunlight exposure. But I do agree with you, it's very hard to treat. Right now, there are some studies that say that there's an organism that's triggering it. And it could even be related to H. pylori infection. Yung sa gastrointestinal tract na
Gastrointestinal.
Oo.
I see. Okay. Attorney, yes.
There's a perception that, going to a dermatologist would be expensive. And that, I don't know if I'm right, but there are many patients who think that, it's something that they can just ignore since it's just a skin lesion. So I see many children or patients with many skin lesions that aren't really being treated. So, what can you say about
It's because of the proliferation probably of over-the-counter cosmetics and skincare products. And also some medications that are, do you know that even topical steroids are available in the Tiangge?
Oh.
Yeah, because you can see some medications coming from overseas that you can just buy so cheaply in the Tiangge. And people buy it because they think that it can help them. So sometimes it's wrong also to just try all these over-the-counter drugs that are, because they can have some side effects. Now, when you say that there is a misconception that skin or dermatology is just cosmetic in nature, it's not really true. But it's because skin diseases are very visible. And so patients get shy when they have skin problems because when they walk and then friends see them, they easily get noticed, like pimples, warts, they easily get noticed. So those are the features that make skin diseases, what you say, cosmetic in nature. But a lot of skin problems are just mirrors of things that are going on inside the body. So sometimes when you have certain conditions, like liver problems, you can have skin manifestations. Like, for example, you can have a sudden proliferation of yung mga red moles, yung mga capillary angiomas or what, or you can have yung sa mga, when your cholesterol is high or you have problems with your lipids. You can have yellowish lesions on the face, dito sa talukap ng mata, you can have those yellowish papules there. So, marami ding nakikitang problems internally which can manifest first as skin lesions.
Right, Doctor. There's really some misunderstanding of the perception of people that if you go, in fact, to the dermatologist, there is something wrong with your hygiene or your hygienic practices is not that well, and so you have skin diseases for that matter. So much so that, well, it's just like going to a psychiatrist, no? People also hide, no? And people will have some impression, there must be something wrong. When he goes to the dermatologist, something is wrong. something like that. And it's one of the things that probably we have to inform people to remove such kind of perception, and that so that people will understand and they will not be embarrassed in going to the
Yes.
dermatologist.
Opo, Father, because sometimes skin diseases are very itchy.
Right.
So,
Right.
they have a tendency to scratch it.
Yes.
So, you create open wounds.
Right.
And when those wounds are there, they can become easily infected. So, they will have pus.
And
Yun yung
people might avoid you
nakakadiri,
for that
di ba? Yes. Kaya yun ang reason why it's not because they're not taking a bath or whatever.
Alright,
It's just that when they scratch it and then it becomes secondarily infected, yun yung, unsightly.
All right.
Can we go back first to go back again to the case of the proliferation of over-the-counter products? What does the law say with regards to labeling or branding such products?
You're referring to, well, what Doctora was saying, no? There's no proliferation of over-the-counter topical application,
Yes.
ano yun, tawag ng mga ointments, even in the Tiangues, no?
Yes.
And, well, okay, the regulation there is that anything that has to be consumed or eaten by the public has to have FDA approval.
FDA,
yes,
yes.
food and drugs. So those things are considered drugs as well. They are applied. They're supposed to have a medicinal effect on people. But okay, many do not seek FDA approval, but nevertheless sell them, no, on the streets, as we can see. Even online, marami din ako nakikitang ganon. And even social media, yon. So, minsan nga hindi mo na kailangan ng tindahan eh. They
Yes,
just
they just
they
sell
sell it.
online.
Oo, so parang when consumers buy it, you buy at your own risk. Now, there's also what we were talking about earlier, that when you go to a dermatologist and they also have their own formulas,
Their own
no?
concoctions.
Yes, and I would think, if since that is doctor prescribed, that it's safe for consumption, of course. Ganon. So it doesn't necessarily need an FDA label.
Okay. Do they have to have a certain like phrase or statement that has to be stamped on the label? You know, like yung mga supplements, di ba? There's
No,
saying
approved
no
therapeutic
claims,
claims,
whatever.
yes. For cosmetic applications, what the law requires is that it should be for external use only. It cannot be ingested because it can be toxic or poisonous or hazardous, and that you keep that away from children. Ganon. So kasi like sunblock, for example, I mean, it's creamy, it looks so people can have accidents by swallowing it accidentally, etc. So that's the labeling prescription. Of course, sometimes yung iba gusto nila may ingredients, and when it go kasi yung mga prescription drugs, yun talaga kailangan ng clinical tests, etc. Literature that the FDA requires. But other than that, hindi stringent yung mga
Hindi stringent.
requirements. Yeah, for it to get FDA approval or to be available to the public. Yung ibang wala na eh. Pero it is not entirely the job of the FDA to police that though. So yun. So that's the scenario na nangyayari ngayon.
Maybe we can ask Doctora Villafuerte, the Philippine Dermatological Society, does it have parang a set of ethical practices connected to the dispensing of concoctions or formulas, especially the ones that are made by the dermatologists themselves?
Yes. Well, our Philippine Dermatological Society has been working very hard in creating ethical rules for our members. And when we dispense products, the formula should be there. The ingredients, what I mean is the ingredients should be there, and then specifically telling the patient how it's going to be used. And also, proper labeling is very important, no?
And do you have to have also FDA approval on those, shall we say, customized formulas?
Yes, we also should prescribe only the ones that are FDA approved. Yes. So the constituents of the formulated medicines that we dispense should be FDA approved. Now, the main problem with some of these products, like I'm not talking about just topicals.
Yes.
Right now, there is a proliferation of yung mga whitening products, di ba? Like
Right.
yung mga, they are classified as food supplements. That's why they are not regulated. So I think BFAD has no control because they are classified as food supplements. Can you tell us more why, if there are food supplements, they cannot be under the law or something?
Suggested.
Yeah. Yes, pag food supplements, yun nga, it should be just a vitamin, for example. It should be, well, it's just a supplement. So it's not meant to result in anything. That's why they always say no approved therapeutic claims. But they market it as, for example, as a
Yes,
whitening. So,
whitening
yun,
agent
oo. So,
or-
kaya nga yung sinasabi mo, yung nagkakaroon ng dilemma, I guess in consumers, na they self-medicate, they self-diagnose,
That's right.
and they self-medicate. Yung nga
Yes,
sasabi ni
it actually
Father at ni
encourages
Doktora.
consumers
But
to
do,
just
yes.
diagnose themselves
Yes.
and seek whatever is
Then go
available
to,
over the counter.
and they think na going to a derma is a vanity issue. They don't know it's also a health issue. If you have lesions like the ones that we showed, that should be cause for concern for you to seek medical attention and not just to diagnose
Correct,
and
correct.
ask your tendera, ano bang magandang ipahid dito, di ba?
Yes, that's true. So, is there any effort or endeavor from the society to educate, the general mass on, the proper use of such products?
Yes, we have brochures and pamphlets that are available in our members' clinics, informing the public of how to take care of their skin. And we go also on regular talk shows in order to educate people about proper skin care so that, they do not spend their money on just useless things, that they are properly taken care of. And we're very thankful for shows like this show that are very informative to the public, no?
Okay, thank you so much, Doctora. Let's just pause this time for another break from our sponsors. Thank you so much.